Hello, everyone, and welcome. Today, we're going to be talking about exercise specific to each of your trimesters. And I know that personally, with my first child, I had gotten all the different advice from many different people, and even my doctors were really unsure how to address exercise during pregnancy. And so, of course, because of that and not having clear advice as a personal trainer, I then went and studied in movement specifically for pregnancy and what we should be doing to take care of our health during our pregnancy, as it's really important part of our overall health and well-being. So today we're going to be talking about the exercise guidelines for each one of your trimesters, the benefits of prenatal yoga and stretching, strength training during pregnancy, cardio during pregnancy, and movement for labor and preparation, and movement in your postpartum recovery, and also common asked questions and concerns. So I'm sure at this point in your life, you guys are already doing this. Follow me on my other platforms. Please, I invite you to share this course, help lead the world's transition to a fertile and healthy future. This is your reminder that this video is really important, and even if you're not at this point in your life where you're trying to integrate these practices, maybe your headspace is somewhere else, just start listening to this information and think of it like planting little seeds, setting you up for success. So many times I have supported women who are like, I will start to take care of myself when, and they keep putting this into the back burner. And now is the time. You're here now. It's in this course for a purpose, for a reason. And doctors aren't and don't have the time to sit down and go through all of these pieces for you in regards to your health and wellness and for your baby's health and wellness. So one of the best things you can do is incorporate strength training and cardiovascular and flexibility and all these things to help your labor progress well, and keep you healthy along the journey of carrying more body weight and all the things that come with pregnancy, as we know. So watch the entire video, and if you need to or want to, you can always put this on faster speed. All right, so let's talk about movement in pregnancy. So staying active during your pregnancy is just not about maintaining your fitness. It is key component to nurturing the well-being of the mother and the baby. Regular movement can help the mother adapt to physical or emotional changes of pregnancy and keep your body strong and resilient. And being active during pregnancy can enhance your baby's health, as studies suggest that prenatal exercise supports better fetal development and can contribute to a smoother labor process. The benefits of staying active throughout your pregnancy includes improved circulation. So movement helps increase the blood flow, reduce the swelling, and prevent common issues like varicose veins and leg crampings. It also can help you reduce stress and anxiety. Physical activity releases these endorphins, the body's natural mood lifters, which can help you manage your emotional ups and downs of pregnancy. And better sleep. Staying active can actually help alleviate common discomforts like back pain and restless leg syndrome, contributing to more restful sleep. And it can help you in preparing for labor. Exercise builds up the strength and stamina, and that is really crucial for your labor and delivery, and it can also help the body recover more quickly. And also, the reality is that during your pregnancy, you are going to gain some weight, whether it's 10 pounds, and for every person it varies, obviously. Hopefully it's going up to the 35-40 range, not the 50-60 range. But as we gain weight, we need more muscle to support the weight gain. So there's that as well. And due to the higher levels of progesterone in our body, what you start to notice is that you may have more difficulty going to the restroom. So exercise actually helps keep things moving as well. So we want to talk about some safety considerations when it comes to movement. Adjusting your exercises by your trimester as your body changes is important to modify as your body needs. So I have different categories throughout this course of like first trimester, you can do this, second trimester, you can't do this. And I really have to then also say this caveat because it comes back to you knowing your body, trusting your body, listening to your body. So if on your second trimester, you don't have a really big belly bump and you're able to still do prone exercises, you can do it. But just know that like, it is putting extra pressure on yourself, on baby potentially. So it all depends on like how you're carrying, how large your belly is, how uncomfortable it is for you. And so I'm giving general guidelines without being able to give that individual consideration. And so I need you to kind of implement that yourself after learning these kinds of things. And listen to your body. So every pregnancy is unique. It's important to pay attention to how your body's responding to movement and adjust and stop the activities if they're causing more discomfort. So for me, exercising really helped me reduce different types of pain in my body. So when I was having like feeling like tightness in my lower back, well, guess what? The more I strengthened my glutes, the more I felt that I had more stability and less of that compression on my lower back. So listen to your body. Signs to stop. So this could be dizziness, chest pain, shortness of breath, vaginal bleeding or contractions. These all indicate a need for rest and or potentially getting some medical attention. All right, so let's talk about it. The first trimester is a time where we're experiencing these physical changes due to the hormone shifts, and you might experience extreme fatigue or potential sickness. Remember, I'm dropping out the morning. So recommended movements during your first trimester is lower intensity activities like walking, stretching, and prenatal yoga. And areas to focus on is your core stability, your pelvic floor exercises, and breathing techniques. So I want to talk first in that section. The physical changes, this is crazy. This is actually every single time I have found out I was pregnant, I figured it out by trying to do some type of cardiovascular exercise and then feel like I was physically going to die. So because of the increase of blood volume in our body to facilitate a growing fetus, what we'll notice is that your heart has to pump a lot faster and it's a lot harder for you to breathe. So it's like shortness of breath and really tired as your body adjusts to the increase in blood volume. And you're experiencing a hormonal shift from not being pregnant to being pregnant. So you have higher levels of progesterone in your body, you have higher levels of relaxin in your body. And so if you are experiencing this, a lot of fatigue and the difficulty breathing, it's not like stop exercising because that's not going to be the answer here. It's going to be incorporating in gentle exercises to stay in the habit and keep yourself regularly doing these things. And the key area of the core, it's so important. Like literally our breath exercise, when we are breathing like this, that forced exhalation like that, we actually are activating the transverse abdominis. And these are these deep core muscles that are going to support your spine, your back, your baby, and keep your body feeling really good as you continue to grow and change. So I was just working with one of my clients who is 12 weeks pregnant and is like, my lower back hurts so bad. And, I just don't want to do anything. And this is not the time to start doing crunches and or doing scissors. This is a time to start with breath work, drawing that navel up and in, and it's to start to work and activate the transverse abdominis. Because of these hormonal shifts, you're going to feel that if it's already weak, it's going to feel weaker. And so it's really time to focus on that so your pregnancy doesn't feel like it's uncomfortable and painful throughout the whole time. The second trimester, the physical changes, you have this growing belly and increased energy and your balance shifts. So the second trimester is like this glowing phase where you're over this like really weird slump of like, I have no energy, I don't feel good, and into a place of like, I am now just, my belly's growing, my baby's growing, I feel happy, I'm like on this high, this wave. And so the recommended movements is strength training, swimming, low impact cardio and or flexibility exercises. And the areas of focus is strengthening your back muscles, maintaining your core stability, and addressing postural changes. So if we think about what's happening in the body as the belly continues to grow, is like if you're not focused about strengthening your back, doing back exercises, like the weights kind of starts to pull you forward. So to be mindful that we'll be training the core and also training those posterior chain muscles to help support you in the glutes. Like your glutes and hips is like taking on the majority of your weight. So making sure that we're still training there. Now, I am somebody who really enjoyed strength training throughout my pregnancy, and I barely dropped back in my second and third trimester with my first and second child. And I don't see any reason, unless there was some type of medical issue. For me personally, I had bleeding with both of my children in my first trimester, and this is the time I backed way off of strength training and really just did some easier movements like swimming, walking, yoga, and it was more gentle movements, allowing my body time to heal, time to rest. And I really didn't add in the more intense things until that second and third trimester. So be mindful about where you're at. If you're just starting out with exercise, then I would recommend working on these areas anyways, like your flexibility and your deep core muscles, and getting that in alignment first before I even would have you do strength training. So regardless of the trimester, I would still have that be the center focus. And also, for the women who have been strength training for a long time, who's not experiencing a lot of sickness, who's not experiencing a ton of fatigue, and they still want to do their regular routine, I can say you can do that, and just make sure you're always monitoring your own body and making sure that you're listening to the signs and symptoms. And also know that first trimester is a time that is really sensitive. So for me with my first pregnancy, I was like, okay, I'm pregnant. I'm going back to the gym. And I went and took my 40-pound dumbbells and I just started pressing up, doing a chest press. And then I started to experience bleeding in my first trimester. And so the lower intensity to really protect yourself in the first trimester, think of protecting your baby, and or gradually shifting into kind of like your normal weight training, and then potentially even increasing your weight in the second trimester to really get your body in a good place for the third trimester when you have most of your weight gain. So third trimester, you have increased weight, reduced mobility, your belly is large, maybe you feel like you can't, bend over and reach and get stuff at this time, and you're starting to prepare for labor in, the 38 weeks and beyond. Recommended movements are gentle walks, modified yoga poses, deep squats, and pelvic tilts. And the area of focus is pelvic mobility and preparing for labor positions and maintaining flexibility. And obviously there's a lot that happens here in like third trimester. Those first couple weeks, it still kind of feels like a second trimester. And then compared to like weeks 38, 39, 40, 41, and 42. Because that might be more like kind of what I'm talking about here, is really working on like being gentle on your body, relaxing, and allowing yourself this practice time to prepare for labor rather than being in this big heavy training phase. All right, so let's talk about some of the benefits of prenatal yoga and how it can support you in your pregnancy. Yoga is a gentle and adaptable form of exercise, and it can really help you during your pregnancy, support your mind, body, moods, and your breath. And yoga can actually create space for the physical and emotional challenges and changes of your body, supporting your overall well-being for mothers on this journey. And the focus of breathing and mindfulness in yoga can help manage stress, anxiety, and foster a sense of relaxation that benefits both the mother and the baby. And prenatal yoga has shown to help prepare you for labor, teaching you breathing techniques and positions that can be used for your contractions and delivery. Now, I would have to say I taught yoga with my third child up until week 39. And it wasn't until I started having some practice contractions where I was like, this would be interesting if I, started my labor here. And I then decided to be done, mainly because I didn't want to be responsible for a whole room of people when I went into labor. So this was one of the best things that I felt like I did exercise wise for my mind and my body. And the breath work that I was doing in yoga, where I was actually like breathing up through the different chakras, redistributed my sensations of my labor. So in my second labor, I was mainly feeling like pelvis, lower back, kind of like your standard, like I would say like an intense menstrual cycle. If you've ever had heavy bleeding, it was kind of like that. But interesting enough, with practicing yoga, breathing, holding energy at the top of my head, actually during my labor, I was naturally doing that. And all of the energy was up in my head, really in my head. And I could just feel this energy building. And with my mind focused on building energy in my brain from practicing yoga, I felt little to no pressure or any really changes down below in my uterus. I felt almost nothing, and I kid you not. I got in a tub because I was cold, not because I was uncomfortable, and I got out of the tub because I was hot, and I was uncomfortable, and breathing and just relaxing my body, relaxing my breath, breathing, 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 focusing on slowing, focusing on opening, until I stood up to move to the room, and then I sat down on a toilet and birthed them. It was all within 30 minutes. So I really attribute that afterwards to regularly practicing yoga. I had no idea when I was doing it that it was going to be so helpful, but it's really being able to find the level of calm, like the level of birth calm while you're in a pose. It could be so healing for you to adopt that mindset to actually prepare you for labor. Nothing else like it. There's nothing else like it. All right, so other benefits of yoga. It relieves lower back pain. So the growing belly shifts your center of gravity, and this can lead to strains in the lower back. Yoga poses can help stretch and strengthen your back muscles and your deep core, oftentimes giving you that relief. So oftentimes I'll hear from women, oh, okay, well, my lower back hurts, so you want a massage. But like actually, if we want to not continuously kind of like put a Band-Aid on an open, gaping wound, then what we're going to do is actually go in and see what's actually wrong. And so if we're having a lot of lower back pain, we really want to focus on strengthening those core muscles. And what's nice about yoga is when you're practicing these different warrior poses, when you're practicing balancing exercises, and it's also tricky because your center of gravity is always changing as your body is changing and adjusting, you are really working on strengthening your deep core muscles, which is going to give you a lot of relief in your lower back. Next is it reduces tension. So gentle yoga movements can help release tension that's commonly stressed areas like your neck, shoulders, hips, and help drop into relaxation. And that's really key. If you really get into the practice of yoga and you're using it to like actually relax your bodies, rest your face, calm your nervous system, then you're going to be able to release tension in your shoulders, your neck, your hips. The hips are huge for holding tension, and allow yourself to get some reprieve and improve flexibility. This is naturally going to happen with your pregnancy, and yoga is going to help, and that can help ease the discomfort of pregnancy and promote more comfortable and mobile experience. And it also promotes better posture. So as the body adapts to changing weight distribution, maintaining good posture throughout yoga can help you alleviate these aches and pains. So there is just this mindfulness of each of the poses. You're not necessarily moving through them super fast. I mean, there are power yogas and different things that you can move them through them fast. But if you're just really being mindful about your body, your breath, the position, breathing, that can help you eventually over time adopt this really great posture as your body's changing. And it encourages this connection. So this quiet time in yoga practice allows you the deep connection with yourself, with your baby, and just like allow yourself to tune in that deep. Allow yourself to experience this pregnancy in that level of care and comfort of just like, can I get to know this baby now, here as a fetus growing inside of me? And know that this bond, this time of you guys together will never ever be recreated in your life. So just really pouring into the special, unique time that you're in. All right, so some of the key pregnancy poses is cat-cow. And this helps stretch the spine and release any back tension and gently engages the core. And cat-cow, like this pose, I actually know that I intuitively in labor was down on all fours and kind of like, gosh, through different refluxes in the delivery process, my body kind of was naturally pushing and moving into that cat, or I should say cow pose. But it's like, you know, once you start doing yoga, you're like, you primarily will find that position when you're delivering your baby as well. All right, so how to practice moving between arching and rounding the back while on your hands and knees and syncing the movement with the breath. So you're going to inhale coming up for cow pose, and then exhale, tucking the tail, rounding the spine, tucking the chin. And you're going to feel when you do this, that engagement of the core, it allows like you to work out any kinks in your lower back. Child's pose or balasana. This is a gentle stretch for your lower back and your hips, and you can also like adjust your arm position, bringing your arm to the right or your left side of your mat to stretch into the lats, which is really helpful, especially if your breasts start getting big and you start to notice yourself slumping forward. So rounding the shoulders back and giving you some stretch in your lats. So you're going to take your knees nice and wide on the mat, or obviously you don't have to be on a mat. You can just do this on the ground. Big toes touching, arms reach forward, and then pressing back into the hips. And what I like to do here is even walk my hands one on top of the other and feel the stretch from my fingertips through the back of the arms, down the lats, and down into the hips, and switch sides. So you can go center, left, or right. And you're working on breathing down into your hips. So, and you're in this position of balasana, if you're feeling this tightness because your hip flexors are really tight, focus on breathing down into your hips, releasing that tension. Seated side stretch. This stretches through the side of the body, creating space for the growing belly and helping with digestion. And how you're going to practice this is sit upright comfortably with your legs crossed, and then just reach one arm over the other, grounding down the other arm on a block or the earth, and then switch sides. And when you do this, you don't want one hip to lift up like you're kind of cheating. It's like, okay, I'm touching the ground, but this hip's lifting. So with the exhale, drop that hip down to the mat, keeping both hips grounded on the earth. Modified warrior pose. This is to build strength in the legs and the core, and it improves balance as the body changes. So you're going to stand with your feet wide apart, bend into the front knee, keeping the back leg straight and reaching the arms out. So in Virabhadrasana, you are establishing this strength, this connection to the earth, and it's like you're focusing on pulling up with your breath through your yoni, holding up with your pelvic floor, turning on these deep core muscles, and then bending into that front leg, feeling the strength building. This is a really big deal because you're going to be continuing to carry more and more body weight. So building up your foundation, like literally the strength in your hips and your glutes, is so key. All right, so next is the guided practice. So here's a sample 20-minute yoga flow for each trimester. So you guys can just check in with the resources area, and if you're in your first trimester, you can actually follow along a yoga practice that I will take you through, and you're going to see that there are different resources for yoga throughout this course as well. So the first trimester flow, you're going to focus on your breath awareness, gentle movements like cat-cow, and short seated meditations to connect with your breath. The second trimester, you're going to introduce strength building poses like modified warrior, combined with hip openers and heart opener poses to support this emotional change and physical balance. And the third trimester is this emphasis in comfort and relaxation. So poses like child's pose, seated stretches, deep breathing exercises can all help you prepare for your labor. All right, so let's talk about stretching for your pregnancy and certain areas to really focus on. So the hip openers is really great because it helps widen the hips and accommodate for your growing baby. So gentle hip opening stretches can reduce this tension and discomfort. An example is butterfly stretch, seated wide-legged forward fold, and or gentle lunges, or malasana or yogi squat in our yoga terms. Other exercises to focus on are your hamstrings. This is going to ease the tension and help release any lower back discomfort. So if you notice, really, actually, every person is really different in their pregnancy, man. I've been in Korea for one of my pregnancies where they kind of just expect the ladies just to lay down for the full 10 months until their baby comes out. I've been in back in mainland Michigan, and pregnancy kind of just moves forward like any other day, and it depends on the woman whether they're physically active or just laying low through their pregnancy. But I say this because it really depends on how you have changed and modified your life during your pregnancy. So if you're doing a lot of laying and or a lot more sitting, then these areas in your body are just going to start to get tight and uncomfortable, and it's going to lead to more aches and pains. So that's why we want to keep moving. So hamstring stretches are going to help ease that discomfort. Some examples is like a seated hamstring stretch with one leg extended, or standing forward with a slight bend in your knees, and or pyramid pose if you're familiar with yoga. There are all different exercises. If you're brand new to it, literally kicking one leg out straight in front of you and hinging over your hips. The other area of focus you want to think about is shoulder relaxation as the baby grows. Shoulders can tend to carry the stress and tension. And also, like, your breast may be growing throughout this time. So it's like making sure that we're releasing through the shoulders, the neck. And so shoulders, arms, eagle arms, we cross one arm over top of the other. And or a thread the needle pose in yoga. Guided gentle neck stretches, so just making sure that as your body is growing and changing, you're just releasing where you'd be holding stress in your body. And I also want to remind you that, like, I don't like to stretch cold body parts. So before you just all of a sudden start cranking and stretching in on your body, get some type of gentle movement first. Like, get up and go for a walk, get moving, get some blood flow to your body before you just start to sit down and start cranking into stretches. All right, safe and stretchings and importance of gentle, slow movement. So during the pregnancy, your body releases relaxin, a hormone that actually loosens ligaments to prepare for childbirth. This makes it important to approach stretching with caution to avoid overstretching and injury. So focus on moving slowly into each stretch, allowing the muscles to relax gradually. Hold the stretches for 20 to 30 seconds while breathing deeply to encourage the release without pushing too far. Avoid deep, intense stretches or movements that could strain the joints or hips, especially those involving the lower back, hips, and belly. So you're actually really flexible and really quickly to respond to different stretches. And so the great thing is you'll be like, oh my gosh, I'm so flexible right now. The problem can be is you feel you can overstretch the muscle. So just make sure that you're warming up first. Like I said, get to moving, do something first to actually warm up the muscle before just sitting down and just stretching. And then be mindful of, like, not to overdo the stretch. Like, give yourself some time to breathe in it, but then also come up out of the stretch. A guided routine stretching sequence to start each day is to awaken your body with some grounding exercises. Like, if you can get down on the earth, that'd be even best. But I do cat and cow for spine mobility, and you're actually activating the core too. So you're doing that inhale and exhale, rounding the back, and it's going to start to, like, increase the blood flow moving. Seated side to side stretch to lengthen through the side body, and gentle hip openers like a butterfly stretch. And then in the evening, winding down and preparing for restful sleep. Child's pose with deep breathing, a seated forward fold, or a reclined bound angle pose or Supta Baddha Konasana can help with opening up the hips and preparing you for sleep. All right, so let's talk about strength training during your pregnancy. Strength training is so important during your pregnancy. This is not the time to do nothing. This is the time to actually increase, even if you're coming from a beginner standpoint. So I said, even if you've never exercised before, it's important to start to add this in a slow, progressive way. Not all of a sudden, I want to be able to deadlift 350 pounds. It's like, okay, no. All of a sudden, it's time to really focus on your health and make sure that you're comfortable throughout your pregnancy. And what that means is that as your muscles and your baby and everything grows and shifts and changes in your body, you can transition with ease and not feel any type of discomfort and pain in your body that's preventing you from movement. So strength training is going to help support the growing baby. So as the baby grows, the extra weight can place strain on your lower back and your core, and strength training is going to help maintain that core stability and allow the body to carry this weight better. It also can help prevent back pain. A strong core can help offset the common symptom of back aches and the posture shift that is caused by pregnancy, and strengthening these areas can help reduce pain and improve your daily comfort. And it helps build your stamina for labor. Labor is physically demanding and often requiring endurance and strength, so regular strength training builds the stamina needed for the challenges of labor, pushing, holding positions during contractions to pushing. And postpartum recovery. So maintaining muscle strength during pregnancy can make this transition to postpartum exercises smoother, helping new mothers to regain their pregnancy fitness levels more quickly. It's true, if you take the entire 10 months off to not work out, not train, and you're sitting at home relaxing and eating, you are going to be more uncomfortable in your body. You're going to feel less mobile, less endurance, less energy than if you're up and moving. And it's also going to help you snap back really quickly. So the one piece that is contradictory for me, as I've had 3 babies and also have been a trainer for many years, is the stamina for labor. So for those go-getter type A mamas who are already out exercising, running hard, and you think, and I'm saying this because I was this person, you think that you got to train harder because labor is so hard and you got to have stamina. I would say to relax more, okay? And then for the person who is really good at relaxing and not up and moving enough, like you're not getting 150 minutes of physical activity a week, you haven't been strength training, then I'm going to say to you, you really are going to need the stamina. And I say it that way because I have been on the over hard side thinking that I needed to train harder. And my 3rd labor, I really just laid in a bed and relaxed for an hour and the baby came out. And it wasn't really about being more physical for me. That actually caused slowing in my previous labors. So I really needed to focus my attention on the relaxation aspect and allowing my body to really sink into surrendering. And then on the other side, if you're not moving at all, then you're going to want to feel like you have the confidence to make it to the end. And strength building actually helps you build that confidence. So I'm speaking to different people. I don't know what side you're on, but there's no one size fits all, right? All right, so resistance band exercises. For the beginner, this is a really great thing to do to start with adding in some strength training. And if you are already been strength training for many years and you are already on your program, you know what you're doing, you've been doing fitness for a long time, then I don't think that you need to go backwards into going to the band exercises. Not saying that this is going backwards, but you can continue on that program. Maybe you add in a phase of resistance band exercises, but just know to adjust your training when you feel like you need to. And visit this potentially as a chance to kind of switch up your training regimen. For the beginner, resistance bands are going to give you a gentle and effective way to build muscle and not putting you in this state where you're lifting heavy weights where you potentially could get hurt. So if you're going to be doing a seated row like this, holding onto bands, squeezing the shoulder blades together, so you're working this with bands, imagine I have them in my hands, you're strengthening the upper back and your shoulders, posterior delt, helping to improve your posture as your body starts to, your forward body starts to grow. So sit on the floor with your legs extended, loop these resistance bands around your hand, and pull the bands towards your chest, stopping at your chest. You're initiating the movement by squeezing the shoulder blades together. Bicep curls, this builds up the arm strength. This could be helpful for carrying the baby and other tasks postpartum. I'm going to be really honest. I trained for a lot of years, never really took breaks, and my shoulders were really tired for constantly holding a baby. And I was like, this is crazy to me that I'm like tired from holding a baby. But it's different when you're not used to holding weight in your arms all day long. Like I had all heavy babies. I had 8.5 up to 9.5. And so it was like, I'm always holding this baby. I'm like, oh my gosh, I needed to train my shoulders more. But, yeah, it's true. I am almost always in a isometric bicep curl because I have a now 1 and 3-year-old, and both of them want to be held and carried. So I'm almost always doing that. So here, resistance bands, extending the arms, bringing the knuckles right up towards your shoulder. Lateral leg raises, this can strengthen the outer thighs and glutes and give support to the pelvis. So you're going to stand with a resistance band around your thighs and then just extend the leg out to the side and back to center. And what's nice about this hip abduction, is you're training that mid glute, and this is really helpful for supporting your pelvis. All right, pelvic floor, why it matters. This is a group of muscles during the pregnancy, and it supports the bladder, the uterus, and the bowels. So strengthening these muscles can help prevent urinary incontinence, reduce the risk of a prolapse, and facilitate a smoother recovery after childbirth. And then also aiding in postpartum recovery. So after delivery, the pelvic floor muscles can be weakened, and these muscles, if we keep them strong during pregnancy, will quickly recover afterwards. So these are the exercises that I like to suggest for your pelvic floor health. Kegels, you're focusing on contracting and relaxing your pelvic floor muscles. So when I say, like with your breath, you're going to think about sucking up fluid, like a straw from your yoni. So sucking up fluid, think about drawing it up, and try to hold that up. Imagine kind of like letting this build. And I actually do this in yoga as a breath work, where I'll actually imagine like kind of pulling up fluid up through my chakras. Up. At the same time, I'm contracting, I'm feeling that Kegel at the same time. I'm drawing energy up and I'm actually contracting at the same time. So one way to practice this is, if you've never done this before, is imagine the exercise that you do, or the contraction, if you had to stop the flow of your urine really fast and then hold that contraction. I don't recommend, nor will any pelvic floor specialist recommend, that you were to do this while you're urinating, because it can cause issues. But just imagine that feeling of, okay, stop your pee, a car's coming or something like that. You got to stop your pee really fast. That's it. That's the Kegel we're talking about. So practice squeezing, holding for 5 to 10 seconds, release it, and repeat it. Bridge lifts, this engages the glutes with the pelvic floor. So you're going to push down through your heels and up with your hips. So tuck your tail as if you had one. Squeeze your butt cheeks together, send the hips up. And if you can pull in with your transverse abdominis and or Kegel at the same time, like really merging the combination of all these exercises all at the same time, that is the best case scenario. So you're going to lie on your back with your knees bent and your feet hip width apart. You're going to press down through your heels, squeeze with your glutes, and lift your hips off the ground, engaging that pelvic floor, and then lower the hips back down. There is deep breathing exercises with pelvic floor engagement. So you're going to combine that deep breathing with the pelvic floor thing, like I was just talking about. So this is going to help strengthen these muscles in a relaxed state. So while laying down and or seated and or on all fours, really depends. Let's try it here. You're going to take a deep breath with your belly. So you're going to feel your belly expand. And then as you exhale, draw up and in. and you're going to Kegel basically, and you're pulling in with those deep pelvic floor muscles. So like I actually make like a triangle like this, and where my thumbs are, I put this right on my belly button. And then where the bottom of my hands are right here, where I'm touching the bottom of the triangle, I'm going to focus on drawing those muscles in right there that you're feeling at the bottom of your triangle. That is giving you this mind-body connection to actually activate and pull these muscles in. And these breathing exercises are so important for your practicing labor and all the things, right? But postpartum. So what's likely going to happen, which I mean, it happened to me for 3 times, but there's a separation of the abdomen as your baby continues to grow. So your abdomen, this linea abia that has like this line in between your like 6-pack, right? It actually like splits or tears or rips, however you want to say it, during your pregnancy. So when you're doing these breathing exercises, you're actually strengthening this connection. You're strengthening your ability to connect and get these transverse abdominis muscles to fire, which are so important for holding up all these parts inside of your body. All right, so there is going to be a guided routine, a 10-minute strength workout for each trimester that you can follow along with. The first trimester is focused on building this solid foundation. So the warm-up is going to be like 2 minutes of arm circles, side bends. Exercises are going to be wall push-ups if you're brand new to this, and or if you're like, I've been doing push-ups forever, that's fine. You can come on down to like bench push-ups, and or if you're already down there on your knees. I know that push-ups for me changed throughout my pregnancy as my belly got bigger and bigger. I ended up going to bench push-ups because I could then get a full range of a push-up rather than my first like baby. My belly wasn't in the way until I was like 34 weeks pregnant, so I could still do regular push-ups on my toes. So just being mindful of where you're starting, and also what is your previous experience with workout, and also how are you showing during this pregnancy? Is the belly even getting in the way at this point? If not, you can progress like normal. Okay, so seated rows. So we're engaging the upper body here, chest with push-ups, back. We have our rows. Lying leg lifts is going to help with your gluteus medius, and deep breathing, and also like throwing in some big strong poses like some squats. So having the knees nice and wide, dropping the hips down, and focusing on engaging the glutes, tucking the tail, driving through the heels, and standing up, firing up with those core muscles. A second trimester, adapting for the changing of the baby. Now this is when you're going to have more energy, likely doing some cat-cow stretches, doing squats, bicep curls, resistance bands, bridges, lateral leg raises, Kegels. A full exercise plan is going to contain at least 2 times a week full body exercises. So I like to actually recommend like 2 back exercises to 1 chest, and then also making sure that I'm putting in more attention into the lower body strength training than the upper body, because this is really what's carrying our weight. So squats, lunges. If you're already experienced, then I would say something like deadlifts is still great, strengthening the posterior chain. If you're new to this, then I would recommend using a closed chain exercise. So actually getting into some resistance machines, like if you have a gym membership, and doing leg extension and or leg curls. And depending on what phase you're in or how big your belly is, I wouldn't maybe stop doing the lying leg curls at this time in your later stage of your second trimester, and go to a kneeling position and or using a cable for a glute kickback rather than doing a prone belly facing down leg curl. And then third trimester, really focusing on your strength and mobility. So you're doing some like gentle hip circles, modified squats, even like just standing, and then using your exhale, sinking down into squats and holding it there, and then engaging from your glutes, tucking your tail, feeling this engagement with your core as you press back up. Seated rows with resistance bands, wall push-ups, and or depending on how well you've progressed throughout your pregnancy, maybe you're able to get down and do them down on the ground, bridge lifts, Kegels, deep breathing, all these things are really helpful for your pregnancy. All right, next let's talk about cardio for pregnancy. So there are benefits to maintain your your heart rate. Cardiovascular exercise strengthens the heart, which can improve your circulation and help your body efficiently manage the increased blood volume during pregnancy. And it helps improve your overall endurance. So cardio builds stamina, which can be helpful for you in your delivery process and in your postpartum recovery and just in general of how well you feel. It's like you're already having so many things change in your body. So if you're actually challenging your heart and improving your cardiovascular endurance, you're going to feel like you have so much more energy. And it helps with boosting your mood and reducing anxiety. So you get this release of endorphins after you exercise, and that helps you manage the emotional ups and downs that accompany pregnancy. And it also helps you reduce swelling. So low impact cardio can help you improve your circulation and your lymphatic drainage, which can alleviate common issues like swelling in the hands and the feet. All right, so let's talk about low impact cardio options. So high impact would be like sprinting, right? And this is a lot for like this downward pressure just in general. Now, if you are a marathon runner and you have always done marathons, then you can continue to have a healthy, viable pregnancy and feel amazing by still running marathons. If you've never run a marathon before and all of a sudden you start to pick it up and run marathons during your pregnancy, I wouldn't recommend that as much. I would say wait for those new things to come in at that intensity after your pregnancy, and really instead focus on these gentler options that's going to be less stress on your body. In general, throughout our pregnancy, if we could have less stress, that's the best case scenario, right? Like just allowing ourselves to be in this phase where we're really nourished, we're really taking care of ourselves. So walking is a gentle and effective way to get your heart rate up without putting all that strain on your body, especially because you are carrying more weight during this time. And walking is amazing because it can be done anywhere, obviously, and it's easy to modify as your pregnancy progresses. So I remember, gosh, during my third child was so much easier. I mean, I was so much more gentle on my body. Like if I was tired, I just didn't push myself as much. And it honestly was a much breezeful birth and labor. And so I was really like kind of honoring more of the lower impact options. But hey, I've also done it other ways where I was not really wanting to downshift in my training. And I still went hard throughout my pregnancy. And it was just a really different experience. So I am an advocate for like literally just tuning in to what your body is asking for. So some tips for you. You want to focus on maintaining good posture and keeping a steady pace and wear supportive footwear. So if you're going for a meander because you want to move your body, then that's a meander. It's kind of considered physical activity. It's not considered exercise. When we're talking about exercise for cardiovascular strength, I'm talking about moving it, like starting to pump your arms and like actually get your heart rate up so you can get those benefits. All right, next is swimming. Swimming was amazing for me at every point in every one of my pregnancies. The buoyancy of water is going to help you relieve the pressure on your joints and your lower back and make it a good choices for all your stages of pregnancy. It supports the body's weight and allows for a greater range of motion, and it can give relief in your body. Some tips is to avoid diving or jumping into the pool and to stick to strokes like backstroke or breaststroke, freestyle, anything, just gentle movement. I remember at the time when I'd get in the water when I was pregnant, I was like, I all of a sudden just don't feel pregnant anymore. I felt like I had great range of motion, and only if I like really pushed it on a set where I was trying to hit a certain number and I was going back to back to back would I start to get some like cramping and or some like, ooh, I think I pushed it a little too much. But you're gonna know that yourself. Get in the water, allow it to help support you, and just feel really good in your body during your pregnancy. Stationary cycling is really great because it's gonna help you get that heart rate up, and also it's not giving you the impact on your joint, on your body, and it also reduces the risk of fall and just impact in general. Some tips is make sure that you adjust the seat height to ensure that you're comfortable and you're not leaning too far forward as your belly grows. Just be mindful of your positioning. If you've never taken a spin class or worked a bike before, you want your leg to be able to extend with a slight bend at the bottom, and then even like hinging forward. You want to be upright. You don't want to be too crouched down. Like this is not going to help you pedal. So making sure that you're upright in the saddle while you're cycling. Prenatal dance. This is a fun way to stay active and connect with the body through music. And it's great because dance allows for this creativity, expression, and movement. And also, like, I feel like you're allowing your body to naturally and intuitively move in a way that feels good to your body and to your baby. And so, low impact is great. It's not that you can't jump or twist, but it's just going to notice that it doesn't feel as good on your body during this time of your pregnancy. All right, so let's talk about intensity. If you carry a conversation, if you can carry on a conversation while exercising, you're likely at a safe level of intensity. If you become too breathless to speak, it may be time to slow down. So you're going to stay within a range of like 60 to 70 or 80% of your heart rate max, like your heart rate max. So I actually always use the talk test to ensure that my clients are at a pace where I want them to be at. And if I'm able to talk and tell you a story, and then I stop and I pause, and I take a breath, and then I keep talking and I tell you about this thing, and then I'm like, but yeah, so anyways, and I might just keep going there and talking at this pace. This is a good measure of the intensity of the workout if you're at. But if I end up asking you a question, or I'm like, how's your day? What are you doing after this? And you just can't respond, this may be pushing it just a little bit too much. While heart rate guidelines can vary, the talk test is the more practical solution, and aim for a perceived level of a 5 to 6 on a scale of 1 to 10. The trainer in me that knows what you're capable of doing would push us to a 7 or an 8 and not really ever take you to a 10. Signs to slow down: if you're feeling dizzy or overtired or receive any discomfort, pause the activity and rest. The talk test is a simple and effective way to ensure that your cardio exercises remain in a safe zone throughout your pregnancy. Outdoor activities, nature walks. This is amazing for your body. You're getting fresh air. It's going to help you boost your energy levels, improve your mood. And grounding. Grounding is huge. Walking on natural surfaces like the ground, the grass, the dirt, the soil is going to help you connect to Mother Nature, giving you this sense of calm. Grounding is so important for our energy beyond pregnancy, but we are more sensitive to everything when we're pregnant because we're just like this open portal, like access to what everybody else has going on in their lives. So if you are ever felt emotionally sensitive or intuitive or gifted, you're going to feel even more of that open up throughout your pregnancy. So just giving yourself a chance to reconnect with the earth is going to help actually set your body into the parasympathetic nervous system. Think of this as like a vagus nerve reset. It's actually like allows you to calm down, to relax, walk bare feet, just be in the grass. It's going to help definitely throughout your pregnancy, and it helps reduce the stress. So the sounds of nature, the smells, all of this is really soothing, but also connecting with the earth actually grounds our energy and allows us to drop into the relaxation. Mindfulness in motion. So incorporating breath exercises and pairing it with walking with mindfulness breathing can enhance the benefits of exercise by calming the nervous system. So you could take a walk at the park barefoot and focus on your breath at the same time of movement. Like you're literally just taking practices of calming your mind and moving your body and pairing it together, and watch how when you do these things, you're not depleted from it. You actually feel really feel activated. Like you feel like, oh my gosh, I feel really, really good. I want to go out. I want to do the next thing. I'm ready to achieve something. So an example would be to inhale for a count of 4, hold for a count of 4, and exhale for a count of 4, repeating for a few minutes. And you might do this while you're walking on the grass, and or when you're laying down on the ground, really connecting yourself to your breath. Nature observation, so you can focus on sights and sounds and smells around you, allowing yourself to be in the present moment. So we talked about this in reducing your stress, but in general, when you're doing a mindfulness exercise, it's really about doing whatever you're doing and just becoming really intentional and really present. And how I teach you to become really present is just to pay attention to everything, like the colors of the leaves. Like, wow, that is really green, that is really yellow. Watching the wind blow the trees, hearing for the different sounds, smelling what is smells around you. And you're just pulling in so much of your senses to bring you really into the present moment, and this can help with releasing stress. A guided walk routine. So here's a sample 30-minute walk with mindful breathing. You're going to warm up 5 minutes. Just start at a gentle pace and focus on expanding your belly. So deep breath. You're expanding and breathing into your belly. So just start to let go of the other things that are going on in your life. Take off your shoes, perhaps. That's what I would do. Allow myself to connect with the earth. Start by just slowing down your breath. And then you're going to get into the mindful walk. So the first 5 minutes, you find a comfortable pace. You focus on a rhythm or your steps, and you're just practicing belly breathing to engage your diaphragm. The next 5 minutes, you're going to increase the pace slightly, focusing on maintaining a steady and rhythmic breath. Inhaling for 4, exhaling for 4. So you're picking up the pace and you're using the breath. The next 5 minutes, you're going to pause and take the all your surroundings in, just being really mindful of the world around you. And the last 5 minutes, you're going to return to a slower pace, focusing on just relaxing, allowing your body to come into the just full surrender, relaxation. And then you can come into a cool down where you just stop in one spot, close and hold your eyes, practice breathing again, and or sit down in a seat with your spine upright, breathing in through your nose, exhaling through your mouth. All right, so next let's talk about movement for your labor preparation and spinning baby movements. These are a set of exercises and movements designed to help your baby find the best position for labor, particularly aiming in the down head anterior position where the baby's back is towards the mother's front. This technique encourages the baby to move into the positions that facilitate an easier and more efficient labor, reducing the risk of back pain or prolonged pushing. So some examples of spinning baby's movement include forward leaning inversions, and this helps to create more room in the lower uterus for the baby to reposition. So you're literally just actually starting to lean forward and or off of a chair or a table. Also, some of these positions are just better done in water, but doing it on the chair or on the couch, if you feel that the baby needs to flip or isn't in the proper position, you're going to kneel on the edge of the couch or the bed and then slowly lower onto the floor, letting your head dip towards the ground. Hold for 30 seconds while breathing. Another option is to actually get into downward dog, where you press off of the ground and you're keeping the feet on the ground, and then you can crawl the legs up onto the chair. Side lying release. This is going to relax the pelvis muscles to support the baby's movement. And so in this position, you're coming right to the edge of the bed or a table or a couch, and you're bringing that lower leg to hold you on support, and the upper leg kind of wraps around, and you're going to hold that position for 1 to 2 minutes on each side. The next is the open knee chest. This encourages the baby to turn from a posterior to an anterior position. So here's how you're going to do it. You're going to get on your hands and knees and lower your chest to the ground while keeping your hips elevated. So in yoga, this is our, gosh, we were just doing this today. In yoga, this is our, well, I lost this name for this, but it's a great pose. I really lost the name for that. That's bothering me. I'm going to think of it. All right, next is pelvic tilts and circles. So this is going to help relieve the lower back and body tension. So you're just like actually starting to sit on like a Bosu ball. This is really great. If you don't have a Bosu ball, you can do it in your chair, just alternating right and left hip and or circling in your pelvis. And this is something that you can start to practice like even a month up until before you labor, where you're just circling the body forward and then back and rotating. This is going to promote pelvic mobility and keep the flexibility, which helps the baby descend during labor. And here is showing pelvic tilts. So on all fours, you're just going to actually feel your pelvis tilt forward and tilt backwards. So I imagine like your pelvis is a bucket of water and it's dumping the water out and then it's rounding it back. So like much like your cat-cow poses in yoga, you're just tilting that pelvis slightly. And now most people find it easiest to do this on hands and knees and or in kneeling. You can do this and or on your back as well. Hip circles, this is showing like on a yoga ball, those circles I was talking about is rotating forward and or side to side and or practicing that pelvic tilt there on the yoga ball. All of these are really great on a yoga ball. All right, squatting practices. This is going to help open up the pelvis, allow the baby to descend down and build the strength in your legs and your core. So some squatting techniques is to use a chair and or help from a partner if you've never done this before. You also can practice in your labor using this with a ball and sitting back onto the ball. But I also think that like just getting into the poses of squats and starting to work on your range of motion and then staying down in Malasana for longer and longer will help you build up the strength to do it. But you're going to stand with your feet wider than your hips, hold on to a chair maybe if this is all new to you, and or a partner, and you're just lowering down into the deep squat while you're lifting your chest and focusing on deep breathing. And this is actually something that my husband and I did during active labor with my second son, is I actually held on to him as I'm feeling kind of like this is overwhelming for me to do alone. So it's a bonding exercise where I'm holding onto his shoulders, and then we would exhale, breathe down through the yoni and drop into a squat. So this can be something that you're practicing with your partner now, where you're like, okay, let's practice our breathing exercises. You're in your third trimester, you know it's coming any day. You're holding onto his shoulders. You drop into the squat, allow the knees to come apart, focusing on breathing your breath down and going into the squat together. And or practicing your Malasana. So you're here, your feet are nice and wide, you're using an upright position with your upper body. And what's nice about these poses, and as you get really comfortable in squats and things, is like this is allowing that natural position for the body, the baby to want to come out, right? Gravity is doing the work now. When you're in these squatting positions, gravity does the work to send the baby down. Instead of being on these positions like lying on your back, that is not going to help move the baby along. Oh, here's my yogi squat, Malasana. So you're standing in this position, bring your feet wider than your hips and then sink your hips down. Bring your hands to your heart. So you don't really want to be slunched over like this. If you're really tight through your calves, you're going to find that hard to do. And so if you find it's hard to get in this position because your heels won't go on the floor, you can put like a block or a brick or something underneath your heels and then practice Malasana that way. Practice makes perfect. So labor rehearsal. Start to think of this as like, I don't know what I'm going to like I mean, every single baby, every single birth is different. Of like, in the past, I wanted to be left alone. Now I want somebody to be with me. So know that you're not going to know all the answers of what you're going to want in the moment, but practicing is really helpful, because then you can be like, oh, I really like it when I get into that side couch position where the legs on top. I really like it when we can squat together, and or practicing these positions and seeing what feels good now, because during your labor, it's going to actually naturally come to you. So stimulating labor positions is practicing these various positions before your labor, and it's going to help you prepare your mind and your body for these different stages. Common positions for labor is your hands and knees. And so like when you come onto your hands and knees, it takes a lot of pressure off your back. And so we kind of showed you Balasana before, where you're in child's pose. You can be up on all fours, kind of moving from side to side in your cat cow, and then dropping all the way back. Side lying position. This is really helpful for your labor to just rest. And so this is if you're a practitioner or a midwife or a doctor, if they have those peanut balls, you actually place that between your knees and just resting in your side lying position. And supported squats. So this is allowing your baby to descend naturally with gravity. And this is when you can use your partner. You can hold on to a wall. You can go onto the toilet where you're actually in that upright squatting position. Your pelvis is just like this. It's ideal for birth. And this is actually, I gave birth to my third baby, was just sitting on the toilet, a perfect supported throne, right? That I felt really comfortable and supported in. And so I could relax while still being in this perfect position. And focus on breathing. So use your breath to manage your contractions. And the best thing that I could have done or teach or train or invite people to do is using your breath more often for any sort of discomfort, and practicing on how we can actually find calm and relaxation with breath. And so breath work is really powerful for staying relaxed and focused during your labor and helping to ease any type of tension or sensation. And so the belly breathing through the nose, feeling this expansion, the belly rises, and then drawing the navel towards the spine, relaxing. Using this during early labor can help you stay calm and focused. Counting breaths, so inhaling for 4, holding for 4, exhaling for 4. And if you really want to focus like complete relaxation, then you really want to make the exhales longer than the inhale, because that's going to really allow you to drop more into that parasympathetic nervous system. So anytime you're feeling stressed or overwhelmed, just going into 4, 6. That's going to be great. Horse lips breathing. This is when you're going to exhale through loose lips, making this horse-like sound. So this helps release tension and keep the face and jaw relaxed, which can in turn help relax the pelvic area. So our mouth, our face is responding to, our body is responding to how our face is holding. Okay, so if I'm like this and I'm trying to relax, I'm going guess what? Like, what are you seeing there? It's like a lot of tension, right? And like this like tight breathing. Imagine like your mouth is like your vagina. Okay. So like we want it to be relaxed. And so like even when I put people in challenging yoga poses or I stop them and I make them hold, I go, relax your face muscles. So first, like think of relaxing your brow, relaxing your eyes, letting your eyes sink into your head. Relaxing your jaw, relaxing. Like if I relax my face, then my body is going to respond to that. So first, when you're doing your deep breathing exercises, it's not intense, it's not contracted, it's actually more and more relaxation, more through the jaw and more through the neck. So the horse-like sound is like this. Like this level of relaxation. And when you do this, actually practice alongside with me. Can you actually feel that your vagina relaxes more compared to... Can you feel it now? It's interesting because that's going to actually be your practice for when you're in your labor. Okay, so your guided routine, practice sessions for labor positions. So start by doing gentle hip circles and just doing like a little practice with your cat cow. I like to do it here on the ball, rounding side to side, maybe putting your ball on the wall and then practicing into your squats, maybe even going down deeper into your deep squats, doing side lying rests, staying here for 5 to 10 minutes. And then just practicing with your breathing and or an inversion downward dog, or coming up off of the ground, sending your legs up, making sure baby's in the correct position. All these things, you're really just starting to imagine the big day, like the D-Day. It's delivery day. And you're getting yourself ready for this, the most amazing day of your life. And you're not doing it with the lens of fear. You're doing it from a lens of curiosity, of excitement, of joy, of blissfulness, and any sensation that is actually happening during your delivery. It's just a sensation. And it was not until I heard this tip of my third baby, I heard it just in time, of course, is you kind of start to think of your labor, I want to call it your delivery more, as a roller coaster ride. So like if you have ever seen a monitored birth where they're actually like seeing like they'll actually measure your contractions, okay? If you have to have like for some reason like have yourself being monitored constantly. I know this was the case with my second kid because I was going for a vaginal birth after cesarean. So they just wanted to have constant monitoring. So just make sure you're having these conversations with your practitioners. Do I have to have constant monitoring? I don't want to wear a monitor. But anyway, so you can actually see the muscle contractions as it happens on the screen. And so think of these like little loop-de-doos as the roller coaster, okay? So the way up is going to be the most intense surge. And so we think of this as the time that we're really dialed in, we're plugged into our breath work, we're focusing on breathing. So this is the time that I'm going, I'm just observing the signs and symptoms. Now at the top of that hill, right, is break time. So there's nothing else happening. It's not progressively getting more intense. It's a break, it's a break, it's a break all the way down. It's a break. And then you have the break in between the next one. There's a break. And then I'm focused again. I'm focused. I'm observing. I get to the top. And now guess what? It's break time. Break time all the way down the hill, all the way across, ready for the next hill. So if you think of it like this, for me, I was like, okay, well, that's 2 to 3. If I have 3 sections, a rise, a fall, a little break before the next rise, 2 of those times I'm actually just resting and I'm really focusing on rebuilding my strength. Like, oh yes, I'm in rest. I'm really relaxing right now. I'm in rest. I'm getting ready for that next big climb. And cycling, if you've ever taken a cycling class, is really similar to this. Like you're actually doing like climbs where you're like intense, like climbing, keeping the focus, like staying in your zone. Nothing's going to distract you. You get to the top and you sit down, you're in a seat and you just pedal, 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 pedal. It's so easy. Your legs are just spinning. It's easy. It's easy, 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 easy. Those are the rest times on the way down. Now, although you're still on the saddle, you're still on a bike, you're still working. It's easy. You're preparing your mind for the next climb. If you don't do this technique and you think that just the entire labor is extremely exhaustible and you just never had a break and it was so hard, well, that story will actually be integrated into you. You'll manifest it. And you can think I'm crazy that you can't manifest your birth, but like you can manifest the birth that you want. And I'm telling you this because I've done it. I've done it where I imagined a hard, long labor, and that's exactly what I got, was a hard 14, 16-hour labor. And I also had a 30-minute labor. So like the time I was actually in active labor was maybe 30 minutes long. And so the difference there was what I wanted to accept as my reality. That was really the difference. And I didn't think of any of the pre-labor as even being anything that was labor. It was like, oh, I just was feeling a twinge here. Oh, I saw some blood in the toilet. I saw some mucus. I didn't start counting those hours for being my labor because I knew it was going to mess with my mind and my energy levels. So I just thought, okay, well, there's some blood. Okay, well, there's some water leaking. And I carried on with my day. And then it was, okay, I'm starting to feel some sensations in my pelvis. Okay, I'm starting to feel like I'm a little tired. I'm going to lay down to rest. None of that I considered labor. None of it was considered labor to me. The only part that I really brought that level of focus in, got this level of like, you got this, Carly, was when I had to zone everything else and just focus on my breath on the way up and then just focus on relaxing on the way down. And that was my 30-minute labor. So it's all about how your mindset of what you're pulling in, what you're thinking about, who is talking to you in the background. And if you're at this point in your pregnancy where you're actually really preparing for labor, this is the time to protect yourself, your energy of who you're letting into your circle, what stories you're willing to listen to. Because everybody around you is going to see you're pregnant and they're all going to want to tell you their stories of their pregnancies. So this is a really important time to make sure that the seeds that you're planting aren't ones of doubt, aren't ones of fear, aren't ones of pain. And I hope that the seeds you're planting are the ones of resilience, of strength, of stamina, of beauty, of full surrender, of ecstatic bliss, of calm, of joy. And I hope that you're set there because it will then be that for you. All right, we will get into like a whole mindset approach for your pregnancy, but like I just got kind of sidetracked on getting our physical body ready because it's all tied together, right? So movement for postpartum recovery. Now this is a big deal because our body just goes through a really demanding process, right? Like literally just the muscle contractions that are constantly happening or the muscle surges to move the baby down. It's important to allow ourselves this time for healing. So postpartum activity can help in the healing process by helping with blood circulation, which can accelerate the recovery of tissues and muscles that happens at childbirth. It can help with your mood, so it increases the endorphins, which is a natural mood lifter, and it can help combat baby blues if you're experiencing any of that. And it's going to help regain your strength. So it's going to help with your core, pelvic floor, back. All these are crucial for your postpartum recovery. And it can help boost your energy levels, which is beneficial for mothers who are feeling like they're sleep deprived and sad. Now, this is really a hard topic for me to teach without really understanding where you're coming from on a personal level. In my first experience with my first son, I needed to get up and get moving from this cesarean that I was having, which caused a lot of gastrointestinal discomfort, a lot of swelling. It was so much pain in my abdomen that like literally the only way to move through it was to get up and move. And so walking was really beneficial for me there. And I had a lot of postpartum blues. And so getting up and moving was really beneficial for me in this time. That obviously comes at the right time and place too, though, because I needed to really allow my body to heal from that surgery. And then with my second son, I was really focused on getting right back to it. Vaginal birth with stitches. I started to push myself running 2 weeks postpartum. And I really don't recommend to any person to do that. I don't see a need for it. I, again, struggled with body dysmorphia where I was just too obsessed with getting back into what I looked like before I carried the baby. And the third baby, I actually allowed my body to heal without stitches, natural birth, and just allow my body to heal by laying with my legs together in a bed, resting and bonding with my baby. And I can say, after experiencing 3 totally different experiences, the one that was most nourishing for my body, for my soul, was to allow myself time to just be with my kid. So not to think about the body, not to think about it. And it was really minimal movement. And this was because I had many tears that I needed to lay basically bedridden. So that was all fine and dandy because I was in a great headspace, because I was taking care of myself and the food that I was nourishing my body. And because I had a longer period laying in a bed, it did take a lot longer to regain this strength 6 weeks afterwards, to start to incorporate movement again into my life. So the initial movements, I would say, for everybody in any point of your journey is just starting on some gentle walks. So when I first got up and going, each of my bursts, it was like, I'm going to walk for 4 minutes. I'm going to walk for 5 minutes. And I'm going to walk for 10 minutes. And it was really small amount of minutes, just starting to get around, walk around the house, increasing the duration and the distance. And then breathing. You can do this at any point postpartum. So this doesn't have to wait for anything. You're actually focusing on those exercises we talked about, where you're feeling and training those deep core muscles, the transverse abdominis, to really help strengthen and retone your body. And it's going to help increase oxygen flow, and that will help your overall health and recovery. And then pelvic floor reconnecting when you're ready. So these gentle contractions, the releases of the pelvic floor muscles can help regain this control, which is really vital after childbirth. So this can start simple as a Kegel exercise, focusing on lifting that up and holding for a few seconds and then relaxing. So walks, breathing, pelvic floor, like thinking about activation of the transverse abdominis, like maybe some gentle movements, feeling some activation there. And then progression. So when is it ready to start? Generally, your doctor will tell you about 6 weeks postpartum. More active exercises can be introduced. However, each recovery is personal for each individual. So I didn't like it when I heard 6 weeks, and I ignored that, and I really wish that I would have listened to it. And again, this wasn't the time for me. I wasn't ready to slow down and shift in there. So I have to say that you can exercise beforehand, but just giving yourself this level of grace of just being available to connect with your baby is more valuable than trying to jump into a workout program right afterwards. And also, what you'll see is because you've honored rest over exercise, you're actually going to have more energy sooner to do more with your exercise program than what you would have if you just kind of gaslight yourself and you're like, I'm just going to get to it, doesn't matter. And I feel because our society is the way it is, and people are just jumping right back into their everyday life after they just have a baby, meaning you might get 4 weeks off of work or you may get 6 weeks off of work, so you just expect yourself to just jump back in, isn't necessarily what your body might be asking for. So when you do decide to start, you're going to do gradual exercises. So low impact exercises, going back to those kind of exercises you were doing in the later part of your pregnancy. So yoga, gentle stretching, stationary cycling, swimming, walking, all of this, and starting to increase the duration and or adding in some light resistance. And then focus really on your core and your backs. So like your body just shifted in a huge way, because now it just let go. Like you're not carrying this baby anymore. You're not carrying the placenta anymore. All of that blood is shifting now. And so there is a really good focus on thinking of that alignment for your body, your back, and your core. So think about this, like you just had this baby, and now you're nursing this baby, likely, hopefully, if you're able to do that. And so you start to naturally start looking down and nursing. And so you start rounding more and more forward. And so just having this focus on like pulling the shoulders back and strengthening your back is really going to help combat that after holding, carrying, nursing this baby, which is a lot of time and attention. So week 1 and 2, the basic mobility and breathing is morning stretching, walking, starting to like move your spine, diaphragmatic breathing, focusing on that connection with the transverse abdominis, and then a short walk, 5 to 10 minutes, and start to increase a couple minutes every couple days. The next 3 to 4 weeks, introduce some light activity. So pelvic floor exercises like your Kegels, start holding for 5 seconds, and then gentle yoga. So like cat, cow, child's pose, gentle movements, maybe gentle twists and turns, whatever's still feeling good for you. And that's really going to depend on your labor or your type of delivery. If you have a cesarean, these might be really different than if you have a vaginal birth, and or if you needed stitches after your birth, and or if you decided to forego stitches and you're going to do what I did, which is like lay and let yourself heal. So for your walking, extend to 15 to 20 minutes and possibly incorporate some gentle inclines or different terrain to build up some more stamina and strength. And then week 5 and 6, so you're going to build on your strength and endurance. You're going to work your core. So when I do this, I think of like bird dog exercises, extending one arm and then the other, those pelvic tilts, these type of things where we're really working on the deep core rather than doing stuff like this, crunches, where we're going to create more of a separation. And when we're talking about core, we're not going to be talking about like these heavy like leg lifts or scissor kicks or any of this really until we heal the diastasis, if that was a issue for you, and depending on the variability of the intensity of that for you. Cardio, you're going to increase your walking to 30 minutes. Start with stationary cycling or swimming if you're able to, and then flexibility, so you can incorporate more of the yoga poses and stretches that could include the whole body. All right, so common questions and concerns. Can I exercise if I didn't pre-pregnancy? Yes, please do. So start a exercise routine is really still beneficial for you. Focus on the low impact stuff. Don't try to do the tricksy stuff. Like don't start a crazy gym routine where you're doing like kip-ups or anything like that. But low impact exercises like walking and swimming, prenatal yoga are all great for starting to build yourself up. Start slowly and listen to your body. What movements should I avoid? So pregnant women should steer clear of high impact exercises, jumping, running, especially if they're not part of your routine before. And after 20 weeks, avoid lying flat on your back, as this position can reduce the blood flow to the baby. Deep twists, especially for those that put strain on your abdomen, should be avoided to prevent stress on the baby. And listen to your body. So during pregnancy, it's important to distinguish like normal discomfort, mild soreness, from like a sharp pain, right? And dizziness and shortness of breath. Like really, you know your body best. And so really just learning to know to trust that intuition. And is it safe to lift weights during pregnancy? Yes, it absolutely is. And it's definitely going to help you. If you've never worked with a trainer before, like you're scared of them, you don't know what you're doing, or you just thought you know it better, maybe this is the time to do it in your pregnancy. Hey, I've been lifting for like 10, 12 years, but now I'm pregnant and I really want to make sure I'm doing it better than I was doing it before because I don't want to get myself hurt. This is a time to bring in a professional to watch you, whether it's virtual where you submit your videos on camera, and or whether they're there with you giving you these connections, like making this mind-body connection, right? When I talk to you about like, okay, touch here. And when you do this now, think of breathing in here. When you have somebody there with you to establish that mind-body connection and ensure you're doing it correctly, you're gonna get so much more out of it. And if you are new to lifting, I actually recommend that you would be working closed systems. So like I would prefer to rather have you on a machine where you can't screw up that range of motion than on free weights. And this is not what I typically say or recommend, but considering the fact that you're new to it and you're really just needing to build strength and work your full body, I'd rather have you do it correctly than be in an open chain system and get hurt doing it, especially when your body is hyper flexible. How often should I exercise? The general recommendation is 150 minutes of moderate intensity a week. So this can be a spread out from 3 to 7 days a week, however you want to do it. And then the recommended amount for actually maintaining your strength, not even gaining, is 2 times for each of your body muscle groups. So it would be like 2 times for your glutes, 2 times for your quads, 2 times for your hamstrings. That is to maintain your current muscle mass, which is the minimum. So if you could get 2, if you want to gain, which I think it's important to think about gaining all the time, 3 days of strength training a week. So 3 days of strength training, full body, in addition to 150 minutes of exercise would be fantastic. Does exercise impact your labor and delivery? Regular exercise is going to help you improve your endurance and strength and flexibility, which can help with a smoother labor. And it also can help reduce discomfort. So it is definitely beneficial. Should I worry about heart rate? In the past, heart rate restrictions were emphasized during pregnancy, but the current guidelines is to really focus on perceived exertion. So the talk test is a much more useful tool than focusing on what number your heart rate's at. All right, so I would really love to hear where you're starting out. I'm in my first trimester. I am completely gassed. I feel like I am dead to the world. I don't have energy, but today I'm gonna do a 10-minute yoga routine. That's what I love to hear. Where are you at? Or I'm in my first trimester. I'm feeling amazing. I actually can't tell a difference at all. I'm going to continue with my regular routine, which is getting to the gym and doing strength training. And I just want to hear where you're at, what's working for you, what makes you feel good and alive in your body and your skin. And if you do have questions about your pregnancy and fitness that hasn't been made clear, you don't know where to go from here, jump on those live Q&As and bring in your charts, your pregnancy charts, your tracking charts, so that way we can talk about what you've been doing, what's working for you or what's not working from you. And so in those times of those live Q&As, I can really drop in with you and answer some questions really quick. If not, you can DM me and or drop it in the community chat, so then that way when I answer your question, other people can also benefit from the information. So I'm grateful for you guys being here. I hope you enjoy this beautiful day. Get out and get moving, and I will catch you guys in the next video.